So overweight is defined as a BMI greater than 25, and obesity is defined as a BMI greater than 30. Really, it's just a glorified height and weight calculation. So we could have two people that weigh exactly the same. We could have two people that both weigh 150 pounds. One person could be extremely muscular. The other person could have a lot of fat. Hi, I'm Dale Wagner. I'm an exercise physiologist in the kinesiology and health science department at Utah State University. Certainly in the US, at least, our culture is kind of based on the scale. You always hear people say, well, how much do you weigh? How much do you weigh, right? You almost never in conversation hear someone say, well, what is your body fat percentage? Some people get frustrated when they exercise and they don't see a change in their scale weight. And that's understandable. They could be losing fat at the same time that they're gaining muscle mass. And so they might not see that much of a change in their weight. And in some cases, especially if they're doing a lot of resistance training, they might actually see their weight increase. But yet they're a healthier person because they have more muscle mass. We have a lot of different methods for measuring body composition. Every method has a pro and a con, or strengths and limitations to them. And so the upside of laboratory methods is that theoretically they're the most accurate. The problem is, of course, you have to go to a research lab in order to be tested. You know, we can't bring the machine to you. You have to come to the machine, basically. Yeah, so as far as the field methods go, most people are probably most familiar with the skin fold caliper. With the skin fold caliper, you would take an area of skin and you're gonna pinch and pull, and then you put the calipers right below where you're holding the fold. And of course, it's gonna give you a reading in millimeters. So basically what you're measuring here is the millimeters of thickness of the fold that you're grabbing onto. And then that information goes into a prediction equation. There's certainly variability in how people pinch and pull. And so you want to try to get to a point where you're standardizing that. Myself, I've been doing skin folds for 30 years, and I still don't trust myself doing a skin fold measurement on people who are obese. It's just common sense. The more you have to pinch, the greater the error or the mistake you're going to make. We know that a field method is not going to be as accurate as a laboratory method, but it can be close. In other words, is it good enough? That's what our research focuses on. We do validity and reliability research to try to determine if a field method is acceptable enough to be used in an everyday setting in a fitness center. Just a couple years ago, we did a study that was actually part of what's called an ERCO grant, undergraduate research. And so we had 3 undergraduate research students who are all now in med school, and they were interested in the reliability and validity of an app. So there's an iPhone or iPad app that you can download, and it's really pretty simple. You just take 2 pictures of a person. So you're holding your iPhone or your iPad, and you take a picture of a person with a frontal view and then a side view. And then there are some crosshairs on the app that you put at various locations. So for example, at the neck, at the waist, and the app sort of walks you through the procedure as to where to put those crosshairs. And then it would give you a % body fat, right? And so you can see the upside of that. This is incredibly simple. Most people have access to a smartphone or an iPad. The app was very inexpensive, only a few dollars. We did a validity and reliability study on this using our BOD pod as our criterion method, or our standard, which we were going to compare this to. What we found was that the app was very reliable. In other words, if we took multiple photos, we would get the same information every time. And so that was encouraging. Unfortunately, it wasn't valid, so it didn't give us, I wouldn't trust the numbers from the app, basically, right? So if it tells you you're 30% fat, you might be 30% fat, but you might be something very different from that. A lot of people look at the DEXA scan as, quote unquote, the gold standard. Even that has its limitations. There's no perfect standard for body composition measurement. The really nice thing about the DEXA scan is that you can get regional or segmental body composition. So for example, we can measure your right arm versus your left arm, your limbs versus your trunk. Fat on the trunk is called visceral fat, and there's a much higher relationship or correlation with that to most of the diseases that we associate with obesity. So cardiovascular disease, diabetes, high blood pressure, and so forth. And with a lot of our other methods, so underwater weighing in the bod pod, we only get total body fat. We can't distinguish where that fat is. Another method of body composition that is common is bioelectrical impedance or bioimpedance. If you have a bathroom scale that gives you % body fat, your scale is actually sending a low-level electrical current through your body, so low that you can't feel it. Whether you use the scale or the handheld method or a more sophisticated research device, the basic principle is all the same. It's injecting an electrical current, and then it's measuring the impedance or the resistance to that current. Certainly the method's easy, much easier than the skin fold calipers. And so for that reason, a lot of people like it because they feel more, in terms of technicians, they feel more confident using the bioelectrical impedance method than the skin fold method. For obese clients or overweight clients, I myself, if I had to choose between the skin fold caliper or the bioimpedance, I would use the bioimpedance for overweight or obese individuals. The limitation, or one of the major limitations of the bioelectrical impedance, is that because it's an electrical current, it's very influenced by hydration status or by water. And so if you do a hard gym workout and you've sweated a lot and you've lost a pound of weight just from sweat, and then you measure yourself with the bioelectrical impedance, I wouldn't trust the measurement that you get from that because of the fact that you're in a dehydrated state. And so you really have to be in what we call euhydration or normal hydration. Some people get frustrated when they exercise and they don't see a change in their scale weight. And that's understandable. They could be losing fat at the same time that they're gaining muscle mass. And so they might not see that much of a change in their weight. And in some cases, especially if they're doing a lot of resistance training, they might actually see their weight increase. But yet they're a healthier person because they have more muscle mass.
So the social factors that affect obesity are numerous and include your gender, your race and ethnicity, your nativity status or immigration status, socioeconomic status, which is usually measured by your income, your education, your occupational prestige, as well as neighborhood characteristics that you live in, social networks or individuals that you spend time with. Hi, my name is Gabriele Ciciurkaite. I am a medical sociologist and an assistant professor in the Sociology, Social Work, and Anthropology department here at USU. In Lithuania, I grew up in a very weight-conscious family. My parents were always very sensitive about their looks and their fitness levels, and they always seemed a little bit judgmental of people with larger body sizes. So all of these ideas and perceptions became ingrained in me. So when I moved to the United States and I became more aware of a larger variety of body shapes and sizes, this really made me question how much of an individual responsibility obesity really is. In my research, I primarily rely on large government-funded data sets. NHANES questionnaire is very extensive and includes questions regarding demographic information, health behavior such as individual diet and physical activity, sleep patterns. They even ask questions about childhood experiences. They also include questions about psychological and emotional well-being. They measure individual height and weight, which is great because we know that self-reported weight and height is not always accurate. They also collect blood and urine samples for various measurements. One of the social factors that affects obesity rates is the neighborhood that you live in. There are a number of mechanisms through which neighborhoods can affect obesity risks. So one of them is food deserts. Food deserts are geographical areas where access to grocery stores that sell fresh produce, not processed foods, is limited. And if you have limited access to grocery stores, you are more likely to rely on convenience stores and fast food outlets where food is high in sugar content, high in salt content, and also more processed. Neighborhoods also vary in their access to built environment, such as sidewalks, bike paths, and as well as recreational facilities and parks. And it's difficult to be active outside without those resources being available. For racial and ethnic minorities, even with higher incomes, their money doesn't go as far in terms of the neighborhoods that they can afford to live. Experiences of racial discrimination is another factor. Discriminatory experiences are considered a chronic stressor, and some research suggests that prolonged experiences of that are associated with a risk of obesity. Based on a manuscript published by Nicholas Christakis and his colleague, your risk of obesity increases by 57% if your friend became obese. If your sibling became obese, that risk for you would be 40%, and if your spouse became obese, that risk would be 37%. So obesity can also spread through social networks. I would like people to walk away knowing that obesity is not just an individual's responsibility. Choices that we make every day and our decisions matter, but our ability to make the right choices depends on the access to resources that allow us to do that. My research findings help parents and other caregivers understand the things that they can change in their living environments to improve their family members' health. Social science research findings will help policymakers and public health officials create interventions that target more than just individual level behavior. Evidence suggests that weight loss interventions are largely unsuccessful. All the weight that individuals lose, they tend to regain that. And even though losses are generally fairly modest, the same goes with diet. So really the only interventions or prevention efforts that work have to target broader social factors and the environments that individuals live in that would make it easier for them to make healthy life choices and to be physically active and to choose the right foods. I teach an undergraduate medical sociology course, which is largely attended by pre-medical students. The MCAT examination that a lot of them have to take before gaining entrance to medical school now includes a part of sociology, which means that the medical field is finally taking notice that social factors and understanding them and how they relate to individual health is important. So I teach them about social determinants of health. I teach them about the history of the medical profession, physician-patient interaction, the healthcare system in the United States. Health problems that the majority of individuals face now are chronic issues. That means that the role of the physician, they just have to understand better the social and economic conditions that their patient is coming from, including their family environment, their home environment, perhaps their cultural background, their language background, their religious affiliation, because all of these things affect the extent to which we are going to be able to take care of our health. For instance, when I lived in Lithuania, we took our family meals, or we considered our family meals to be an important time to get together and spend time with each other. My parents never allowed us to watch TV while we were eating. which my experience, of course, was very different when I came to the United States, where a lot of meals are taken on the go, in the cars, in a rush, without really sitting down and appreciating it. I love the American fast pace of life, and I love the unhealthy eating and snacking and getting Starbucks, and I consider those treats in my life, even though it does make your relationship with healthy eating more challenging. People gain weight when they consume more calories than they expend, so of course individual choices matter. However, individual responsibility can only take its full effect when people have access to resources to live a healthy lifestyle.
So many people try to engage in weight loss programs to address their weight concerns. Right after they engage in a weight loss program, they see short-term results. Unfortunately, many people who participated in those weight loss programs tend to gain more weight. We need to focus on wellness. My name is Miyairi. I'm Associate Professor of Health Education and Promotion in the Department of Kinesiology and Health Science at Utah State University. My personal story started me to address this issue. I was a sprinter in junior high. I was practicing on the field, and then suddenly, PE teacher came up to me and then said, the size of my thigh was too big. And so his comment started me to think, oh, maybe my body, especially my thighs, were not right for my sport. And so I started restricting what I ate, and then also I started being more conscious about my appearance. I took a college course taught by my former mentor, Dr. Justine Will. She talked about disordered eating and eating disorder behaviors among athletes, and then that moment she covered the topic, I was like, oh, that was me. So that's how I realized I was engaging in disordered eating behavior even back, when I was in junior high. The definition of obesity is a simple ratio between weight and height. We cannot really assess anyone's health or well-being based on the simple, equation. What we need to focus on is our health habits, how we live, and then how we enjoy our life. I feel like, this is my mission to teach college students. They're going to be the ones who are going to go out in the community to provide health promotion education. So I want to make sure they deliver evidence-based programs and then best practices that work for the community members in the safe manner. The Health at Every Size teaches us to be kind to ourselves as well as others. One of our former students is a health educator at Salt Lake County Health Department, and she is in charge of employee wellness program there. And before she was hired, the team has been implementing the principles of health at every size since 2012. We have analyzed their data since 1990 to 2012, and then also between 2012 up to 2019. Health at every size approach. How is it working for the employees within the employee wellness program? And our first initial data analysis show we had a better health trend after 2012. So this is a perfect, research evidence showing that, this approach works. Weight inclusivity is first principle of health at every size. So what that means is we just need to accept and respect diversity of body shapes and sizes. Second principle is health enhancement, making sure people have resources that they need to live a healthy life. So eating for well-being is pretty simple, responding to your body cue. When you are hungry, make sure you eat well and don't skip or don't ignore the body cue. So being mindful of what body tells you to do for your health. Are you hungry? Are you thirsty? Are you full? Or how full are you? Life enhancement movement is just engage in joyful movements and regardless of level of the movement. Like eating for well-being, we don't need to stick with restrictive physical activities or exercise routines. So you pick and choose, dance, swim. For me, hiking, skiing, snowshoeing, and mountain biking, cycling, and walking with my dogs and the family. Be mindful of how you feel when you engage in physical activity and then make sure you enjoy it so that the behavior can become a habit. If you want more information, here are resources that I recommend. The Food, Health and Wellness website from USU Extension, Dr. Linda Bacon's book, Health at Every Size, a training program called Health for Everybody, the Living Well with Chronic Conditions program, and the Living Well Utah program. You are worthy of a joyful life. Find positive connections with friends, family, co-workers, food, physical movements, and yourself. Think about how you are affected by the environmental factors around you. Evaluate how you define health and find programs that focus on well-being.